Welcome to the webinar, everybody. We will begin shortly. There are several people joining still. Thanks so much. Okay, we'll give people another few seconds to join and then we'll get going. Okay, well, welcome to the webinar. And good morning, good afternoon, whatever it might be for you. This is a super special webinar event for us, empowering nutrition professionals to advance sustainable food systems. Very excited to be part of it today. My name is Dina Aronson, and I'm the Director of Nutrition Programming for Diet ID. I'm so honored to help host this event with Food and Planet, a nonprofit whose mission it is to equip 1 million health professionals to advance regenerative, sustainable diets by 2025. So a few housekeeping items before we get started. This webinar is being recorded, and details on how to access the recording and the presentation slides will be sent out to all registrants next week. Please use Zoom's Q&A function to submit your questions, and the speakers will answer as many as possible at the end of the presentation. Pending approval, this webinar will offer registered dietitian nutritionists 1.5 continuing education credits, and you will receive an email next week with instructions on how to claim your certificate. The white paper that is at the heart of today's event is now available for download at foodandplanet.ck.page. I just posted that link in the chat, and I'll post it again throughout the webinar so that you can grab it and download that white paper. We'll also include it in the follow-up communication with you. Finally, there will be a short 2-question survey at the end of the webinar, and we really hope you'll take a moment to answer those questions so we can better understand your thoughts and viewpoints on today's topic. You're joining us today because you want to learn more about how you can help evolve modern food systems to become more equitable, sustainable, and culturally responsive and diverse. You're about to learn the key findings from Food and Planet's new white paper, featuring 8 essential strategies of how nutrition professionals can accelerate the transition to more just and sustainable food systems in their practices and profession. Today's conversation features phenomenal speakers who will share their expertise and shed light on ways to empower all of us to do our part in building sustainable food systems. I'm going to keep their intros brief to save time for their expertise, but I encourage you to visit the webinar page on the Diet ID website to read their extended bios, because these individuals are truly extraordinary in their backgrounds and accomplishments. And it is my honor to introduce our 4 esteemed panelists. First, Becky Ramsing, MPH RDN, is the Senior Program Officer at Johns Hopkins Center for a Livable Future, where she oversees research, communication, evaluation, and programs that facilitate a shift towards sustainable, healthy diets. She's also responsible for managing the center's science advisory role with the Meatless Monday campaign. Prior to joining the CLF, Becky worked as a technical advisor for nutrition and food security projects in Afghanistan and Ethiopia, helping women produce and utilize food for family consumption and income generation. David L. Katz, MD, MPH, is a globally renowned expert and a leading influencer in preventive medicine, health promotion, lifestyle medicine, and nutrition for over 30 years, with over 200 peer-reviewed publications, hundreds of health columns, and 18 books to date. He is the founder and CEO of Diet ID, president of the True Health Initiative, and founding director of the Yale Growth and Prevention Research Center. Dr. Katz has earned numerous awards for his contributions to public health, including 3 honorary doctorate degrees. Selena Ahmed, PhD, is Assistant Professor of Sustainable Food Systems at Montana State University. She is an ethnobotanist with research and outreach interests at the intersection of the ecological, cultural, and health aspects of food systems. Dr. Ahmed has carried out food systems research in indigenous and rural communities in China, India, Morocco, Venezuela, Belize, and the Dominican Republic, and the US, quantifying influence of agricultural practices and food environments on biodiversity, crop quality, livelihoods, food security, diets, and health outcomes in the context of global change. Finally, Liesl Carlson, PhD, is a dietitian, assistant professor, and acting director in the School of Nutrition and Dietetics at Acadia University in Nova Scotia, Canada. She co-chaired the Dietitians of Canada Sustainable Food Systems Leadership Team from 2016 to 2019 and has been working on the ICDA Food Sustainability Initiative since 2017. Her research and community work focuses on community-level engagement with sustainable food systems and diets, and currently the strategic role of dietitians in that work. Welcome and thank you to all of our panelists. And before we begin, I am so honored to introduce Food and Health's co-founders and collaborators on the white paper, Kate Geoghegan and Chris Vogliano. Kate is an award-winning dietitian and nutrition pioneer who has helped millions of eaters fall in love with foods that are transformative for people and planet. She is the author of Go Green, Get Lean, Trim Your Waistline with the Ultimate Low Carbon Footprint Diet, a columnist with Clean Eating Magazine, an advisor to New Hope's influencer program, and a strategic partners for some of the world's leading purpose-driven companies and investment funds. She also serves on the Global Council of Directors of the True Health Initiative. Chris is a globally recognized public health dietitian who's working to link the fields of agriculture, nutrition, and health to promote more sustainable diet patterns. Chris is a technical advisor of food systems with the USAID Advancing Nutrition and is part of the Global Diet Quality Project to adapt country-specific tools for the first ever global diet quality monitoring system in partnership with Harvard University and Gallup World Polls. To kick off the webinar, I'm going to turn it now to Kate. Thanks so much.
Thank you, Dina. And thank you also to Diet ID for hosting this today. We're so honored to have you as a partner on today's white paper launch. And I know I'm really looking forward to hearing from all of our esteemed panelists. And thank you to all of you, everyone tuning in today. It's been really fun to watch the chat and see so many globally recognized names of colleagues whose work I sort of follow coming in today. So thank you all for making the time today. We at Food and Planet hope you and your loved ones are staying healthy and well. Well, the UN Food Systems Summit is in full swing today in New York, and Chris and I were talking this morning. It's been amazing as we've been listening to what they are talking about today, already to see how much overlap there is between how sustainable diets are being framed there and what we will be covering with you today in the next 90 minutes. So here's our agenda today, and we invite you to tweet us at foodplanet.org. Let's keep the conversation going there as well. And just one last housekeeping reminder, because some of you are just joining in, please post your questions in the Q&A part of the Zoom. And I think we have a slide on learning objectives, just to help you see our learning objectives for today. And before Chris and I dive into the white paper itself, and I really pass that off to Chris, I just wanted to share a little bit about Food and Planet with you. So really, as Dina said, we were actually founded in 2020 by 4 registered dietitians. And our mission is to empower 1 million health professionals with the power of sustainability by 2025. We really envision a practice of nutrition that honors nature as the foundation of public health. Without nature, there is no health for humans. And by embracing rigorous science, traditional knowledge, and collective innovation, we aspire to work collaboratively across disciplines to co-create and advance sustainable food systems for all. So that is our mission. And while Chris and I are here with you today presenting, we are honored to work with 2 additional co-founders who could not be here today, Sharon Palmer and Shireen Chow. Sharon is an award-winning author, blogger, speaker, and media expert on plant-based nutrition, cooking, and sustainability. And she's particularly known for her leadership and expertise around plant-based and sustainable diet patterns. Shireen Chow is another amazing co-founder, award-winning dietitian within the fields of sustainability, plant-based diets, and social justice within our food system. She's an advisor to the Teaching Kitchen Collaborative and many others. And she's the co-creator of the Certificate of Training on Sustainable Food Systems for the Academy of Nutrition and Dietetics. In our first year as a team, our real passion has been, how do we create open access learning and also facilitate that among our colleagues, because this is really a group collaborative effort of colleagues around the world coming together with best ideas and practices so we can learn from each other and begin activating. In May 2020, we launched our Sustainable Food System Masterclass in partnership with Today's Dietitian. We are really honored that we've already had roughly 12% of all dietitians in the US go through that masterclass program for continuing ed. And we've done roundtables, idea labs, and then today we're excited to continue our journey by launching this white paper. We're also very honored to have with us a world-class group of advisors and directors. These are really diverse experts from across different touch points in the food system, forming a dynamic ecosystem who we really believe will help us shape the future direction of food and planet. So thank you to all of our advisors and directors. They're such an important part of how we are going to together get to where we're trying to go. And then our broader ecosystem, you can see some of our allies, including True Health Initiative, another one of David's projects, Dr. Katz's projects, and our activation partners with some of what we've done. We are really grateful that this white paper was made possible by a grant, a contribution from Barilla North America to our nonprofit. So we are grateful for their support. They had no input on the paper itself, but they gave us the grant to do the work. So we're very grateful for that today. At Food and Planet, really one of the reasons we started this nonprofit is because we watched all of these reports come out and just seeing this alignment that there's growing awareness the path forward really has to honor nature at the heart of human flourishing before we try to achieve any of those other goals we are working on, either globally or in our community or in our own shopping cart or shopping food experience. So we thought, how do we communicate this and really distill best practices to make them relevant to our profession? So before we start, we just wanted to share our definition of sustainable diets. We really favor the definition from 2012 from the FAO, just so that we're all clear on how we are defining sustainability. Sustainable diets are those with low environmental impacts, which contribute to food and nutrition security and a healthy life for present and future generations. They are protective and respectful of biodiversity and ecosystems, culturally acceptable, accessible, economically fair, and affordable, nutritionally adequate, safe, and healthy, while optimizing natural and human resources. So it's really a tall order, but that is the evolution of our profession. How do we encompass all of these? And what was really interesting is the gap that Food and Planet is trying to close. When we did our white paper, our master class in May of 2020, we've had the opportunity to survey over 5,000 dietitians. And what we found was nearly 70% of dietitians surveyed believe they should be leaders in sustainable food system education, but 87% rated their own personal knowledge of connections between food and planetary health as average, low, or non-existent. So that's really the opportunity to close the gap within our profession that we saw at Food and Planet. And I know other colleagues around the world are working on this as well. And if we take that lens a little bit differently to consumers, we see similarly two things. not only do consumers have trouble understanding and knowing what is sustainable, we see that 67 to 68% of consumers agree with the statement. It's hard for consumers to know whether the food choices they make are environmentally sustainable. But what's really exciting is on the right, the data found almost 70% of consumers say that if it was easier to know whether my food choices were environmentally sustainable, it would have a greater influence on the choices I make. So we see this as that white space of opportunity to really empower consumers by helping dietitians be informed and ready to meet this challenge. And how we've done that is really this concept of taking everything I just talked about together and evolving how we think about sustainable, healthy diets. At Food and Planet, we've really come to honor the 4 dimensions of sustainability and sustainable, healthy diets: sociocultural, planetary, nutrition, and economic dimensions. And that's really what I am excited to pass on to Chris Voliano now to share exactly our findings from the white paper and what are these essential steps we can be taking as a profession to start closing some of these gaps. So let me pass now to Chris.
Great, thank you so much, Kate, for teeing that up and introducing Food and Planet. As mentioned, my name is Chris Foliano, co-founder of Food and Planet, and so excited to be here today speaking with you all, and even more excited to be here listening to our esteemed panelists. As Kate mentioned, the UN Food Systems Summit is going on today, and it's very interesting. There's much alignment between what they're talking about and what we're going to be talking about today, also what's in this white paper. So it's an exciting time to see the science and consensus kind of going in the same direction. One thing I took away from the talks this morning was that food is the future, and the future is at stake. And the reason for this is because food is fundamental to shaping our health, our communities, our economies, and our collective well-being. Yet at the same time, our current food system is one of the single largest pressures on the planet and threatening Earth's operating systems in which we depend on. So nutrition professionals have long influenced, shaped dietary guidance by providing evidence-based care to help people and populations through food and nutrition. Nutrition professionals make up a range of practitioners, from dietitians to medical doctors, nurses, and other healthcare professionals that provide valuable nutrition guidance. And research consistently shows that nutrition professionals rank among the most trusted professionals in modern society. And we work across a wide spectrum of touch points in the food system, such as hospitals, schools, indigenous communities, public health, prisons, refugee camps, within clinical settings, nutrition care, academia, and beyond. So it really is a really special opportunity to work with nutrition professionals to advance sustainable food systems. And really, that's what our white paper aims to do. How do we meaningfully activate change at the scale, scope, and pace required? So today, we're going to be discussing a few findings from our white paper, but also the link is in the chat, and we will follow up afterwards with the link so you can download that and share with your share with your colleagues. So at the beginning of the white paper, you will find 4 key insights that are listed here on this slide. And I'll briefly run through these because we think they're very valuable. So the first is that nutrition professionals are underused and utilized change agents that really do hold the potential and opportunity to help transform the food system. That is everyone on this call. We all have a responsibility to become change agents in this field. And also, food and nutrition guidance must evolve to encompass the 4 dimensions of sustainable diets, which Kate talked about in the previous slide: sociocultural, planetary, economic, and nutrition. And these all 4 must be met if we truly want to create equitable public health outcomes that can support healthy people and a healthy planet. Number 3 is that we must actively elevate and accelerate strategies, 8 of which we'll discuss on later slides, to realize the global health goals and targets set to help protect people and the planet. And number four, and this one's so important, is that diversity must be expanded within our public health profession as well as within our food systems if we are going to effectively build culturally responsive, biodiverse, and nutritious food systems that work in harmony with the planet. So two tables that are found within the white paper, there's this one and the next slide. Our team was able to begin mapping sustainability alignment across numerous national food-based dietary guidelines from Brazil to Israel, Sierra Leone, China, Estonia, and even the United States. We checked these food-based dietary guidelines for a variety of sustainability topics across the four dimensions of food systems, such as nutrition, limiting ultra-processed foods, ensuring nutrient adequacy, planetary, such as food waste and packaging waste, sustainable seafood, and also promoting planetary and dietary biodiversity. Economic, which is fair labor, dignified labor practices, and supporting local food economies. And sociocultural, such as gender and racial equity, food justice, and cultural responsiveness. And as you can see here, the green boxes mean that the food-based dietary guidelines included topics, and then the red circles mean that they did not address these topics. So some key findings that we found examining these food-based dietary guidelines were that after promoting nutrient balance and adequacy, the three most consistent recommendations were limiting red meat consumption, limiting processed meat consumption, and limiting ultra-processed foods. There's also high alignment on key opportunities and actions, but strategies must really be tailored to meet countries' economic and cultural considerations. And one example where this really comes very clear is in developing economies versus higher income economies with animal source foods. Many lower income populations would actually greatly benefit from consuming small amounts of animal source foods to meet their nutrient goals. However, in high income economies, we would actually see tremendous health and planetary benefits from reducing consumption of animal source foods. The last note I wanted to mention was sociocultural dimensions and considerations were the least likely of the four dimensions of sustainable diets to be featured in food-based dietary guidelines or global dietary frameworks at all. So we also mapped sustainability alignment across landmark global reports from the UN FAO, the World Health Organization, the Culinary Institute of America, World Wildlife Fund, Eat Lancet, Harvard, World Resource Institute, and the British Dietetic Association. Here we found more integration of the four dimensions of sustainable diets, including topics such as biodiversity, food justice, fair labor practices, regenerative agriculture. These topics appeared more in these landmark reports than they do in food-based dietary guidelines. However, overall, both food-based dietary guidelines and these reports have much room to expand to include all four dimensions of sustainable diets, particularly within planetary and sociocultural dimensions. All right, so these are my last two slides before we get to the esteemed panelists, but we wanted to share with you the 8 essential strategies to empower nutrition professionals, which you can find in detail in the white paper. We'll go through each of these 8 strategies, and then we would love to hear your comments in the chat and in the Q&A if you have any questions. But these are the ones that emerged from the literature when we did our scoping review. So the first one was to advance professional knowledge, attitudes, and practices. And to do this, we must facilitate knowledge development and empower the next generation of nutrition professionals through updated frameworks and expanded competencies using a systems lens. The second was we must evolve languaging and messaging to follow the science and become more inclusive. The third was that we must activate systems change to transform health and food, which we can support by facilitating institutional changes, for example, to become more equitable, resilient, and inclusive of wide diversities of foods. The fourth one is, as nutrition professionals, we must facilitate transdisciplinary partnerships and dismantle silos around knowledge and practice. Systems require a collective effort, and we cannot do it alone. The fifth strategy is that it is essential for nutrition professionals to integrate culturally responsive practices. I know personally in my training as a dietitian, this was something that was not even really considered. But this is one of the most important and underutilized strategies to advance sustainable food systems. And we can do this by first practicing cultural humility and ensuring our practices are responsive to traditional and cultural eating practices, inclusive of indigenous knowledge. We must also expand the diversity of the nutrition profession to reflect the communities in which they serve. The sixth is ensuring food and nutrition security. This almost goes without saying, but we now have additional strategies to achieve this, such as working on improving food environments and screening clients for food insecurity to connect them with community nutritional resources like SNAP. The seventh is empowering consumers through the promotion of sustainable diets towards foods that are healthy for people, climate resilient, and require fewer resources to produce, such as encouraging the consumption of more minimally processed plant-based foods. Sustainable blue foods, such as seaweed and bivalves, serve a unique opportunity to meet the 4 dimensions of sustainable diets as well. And last, but definitely not least, is we must adapt guidelines and policies to reflect the needs of both people and the planet. And this must be done through the co-production of knowledge, inclusive of those who grow our food, such as farmers, indigenous peoples, and even civil society movements. Overall, a key theme emerged from our white paper is that while broad alignment exists on the core principles of healthy and sustainable diets, solutions can and should look very different, contextualized for local cultures, food traditions, and regional food system potentials. These 8 essential strategies provide a roadmap to empower nutrition professionals to advance sustainable food systems. So now I'm so excited to pass it over to our first esteemed panelist and trusted Food and Planet advisor, Becky Ramsing with Johns Hopkins University Center for a Livable Future. Over to you, Becky. Thanks so much.
Hi, thank you so much. I'm really happy to be here. Just gonna get my notes up here. Great. So as I said, I'm really pleased to be here with you, and I'm passionately committed to the role of nutrition professionals in the food system. This report and others have skillfully outlined findings and insights on what is needed to prepare and engage dietitians and nutritionists in all aspects of the food system. What I will add then is just some perspectives I've learned and incorporated from over 30 years of practice as a dietitian and public health professional. I actually completed my dietetic internship and began my clinical work at a Harvard teaching hospital in the late 1980s. The nutrition approach then was narrow, and it often shifted. Though it aligned with current science at the time, for example, that cholesterol and saturated fat are increasing risk factors for heart disease, its singular focus tended to overcompensate. For example, fat was the culprit. Next slide, sorry. Yes, fat was the culprit. As a result, the guidance provided was just to eat carbohydrates and that sugar was fine as long as calories were moderate. This gave way to the birth of refined, low fiber, fat-free foods that were not satisfying. They tasted bad and they were nutritionally inadequate, even higher in calories in some cases. And manufacturers are smart. They follow the trends and they create products to suit consumers' interests. For example, Snackwells, Entenmann's, and other fat-free products. Everything was promoted as cholesterol or fat-free, even sodas. From fat, the nutrition guidance then shifted to trans fats, then sugar, and all carbohydrates were now bad. These low carbohydrate diets missed out on whole grains, fruits, and even vegetables, and promoted processed nutritionally deficient products. Even now, an overemphasis on protein has given way to new processed products to meet consumer demands. To compound this, nutrition was not prioritized in medical settings. It was, and often still is, secondary to treatment. This made working across disciplines with a coordinated approach to nutrition extremely difficult. Dietitians were often out on their own. Next slide. I believe that the reason this happened and keeps happening is because we tend to focus on singular problems and singular solutions. But as you know, food and eating are complex. On the other hand, systems thinking is a vantage point from which you see a web of relationships rather than focusing only on the detail of any particular piece. In a system, events and issues are seen in the larger context of a pattern that is unfolding over time. A system does not exist in isolation. You can't change one part without affecting the others. This is different from the scientific method in which the goal is to establish causality. To be turned scientific, a method of inquiry is commonly based on empirical or measurable evidence subject to specific principles of reasoning. Systems thinking, on the other hand, seeks to understand complexity and prioritize better interventions while anticipating unintended consequences and feedback loops along the way. Next slide. This is demonstrated through this diagram of the food system. The food system spans the activities, people, and resources involved in getting the food from field to plate. Along the way, it intersects with aspects of public health, equity, and the environment. In the same way, the food system is not linear. It involves many different circular systems that have impacts and also impact other systems. The biophysical environment, including the climate, impacts and is impacted by the food value chain. Similarly, health and policies interact so that solutions for one need to take into account the many other areas. Food decisions have consequences across the entire system. Next slide. Nutrition plays a key role in all of these areas. Registered dietitians and nutrition professionals are key players with unique training in science, but also communicating, facilitating, and equipping consumers to make the shift and be aware of the changes they need to make. Working with students and in sustainability these days, I believe we've come a long way in our field. The results of this Food and Planet report echo that there is more interest and openness than ever, and more resources are being developed. But we still have a long way to go, and we have a warning. We can't approach it in the way we've done in the past. We can't make the same mistakes. Next slide. At the Center for a Livable Future, where I work, we work at the intersection of the food systems and public health. Understanding that public health and environmental impact of producing food, like meat and seafood, policies that support or hinder equitable access to safe, healthy food, and impacts of our food system on our health, from wasted food to meat and dairy consumption to resiliency after floods, droughts, and disasters. As an example from our center of using systems thinking and nutrition, researchers at our center developed a novel model which calculated the greenhouse gas emissions from country-specific food consumption data. We then modeled different plant-forward patterns within those country-specific contexts, including the impact of imports and exports. We saw a huge variation in how much greenhouse gas emissions could be spared by shifting diets depending on baseline consumption. For example, beef-producing countries such as Brazil and Argentina would have a far greater impact of reducing beef than in India, which consumes very little meat. But when we then looked at the nutritional completeness of these diets we were promoting across the countries, we saw that many of these low-carbon dietary patterns were nutritionally inadequate, primarily because many of these lower-income countries undernutrition is still unacceptably high. Too many people are not getting enough protein, energy, and micronutrients on a daily basis. And the consequences are huge. A recent World Bank report identified this as human capital. Human capital is the knowledge, skills, and health that people accumulate over their lives. It is a central driver of sustainable growth and poverty reduction. When people, especially children, are undernourished, we lose their productivity and the thriving and flourishing of their community. So we adjusted the diets we modeled to have adequate protein, calories, vegetables, and fruits, and limited sugar. And we also modeled the Eat Lancet planetary health diet, which addresses both planet and human health. And this is the picture that you're seeing now. We found that in a good number of the countries, the greenhouse gas emissions of diets will actually need to go higher for a minimally nutritious diet. The dark blue countries that you see would have reduced greenhouse gas emissions, but those in red would have higher greenhouse gas emissions. In other words, the burden of drastically reducing greenhouse gas emissions through eating less meat and dairy, as well as through energy and transportation sectors, lie within our higher income countries such as ours. And for those other countries, we need to advocate for better, planet-friendly, and nutrition-sensitive agriculture that supports small farmers and economic thriving, rather than looking to productivity-focused industrial agriculture. If we had only focused on climate, we would have been advocating for nutritionally incomplete diets for much of the world. If this is overwhelming, maybe it's because you're a systems thinker. You understand that there is complexity, even when you don't grasp every part of it. So I'll use the rest of this time just to review a few more lessons I've learned along the way. Being a dietitian and raising kids turns out is great for doing a lot of interesting work, but not very good for an upward career. However, I've been fortunate to work across different settings and countries and have been exposed to many of these complexities, which helped me grow and evolve as a nutrition and public health professional. The first I'll say is lean into imperfection toward professionals as well as consumers. One of the best lessons I learned from a fellow dietitian was not to push or even ask for perfection when we work with consumers. I remember we were doing a class together on healthy eating at home, and she's told people that getting takeout and eating it at home and as a family is a success. She was able to acknowledge that busy parents can be totally overwhelmed when we tell them to cook whole meals and eat as a family. Do what you can or take one step is a freeing message for people and empowers them to take next steps. Maybe after they get a dinner routine, they can find more time to plan and prepare a cooked meal at home. At CLF, we're also science advisors for Meatless Monday. In all the calculations, though, that we do, Meatless Monday or Meatless Day doesn't really make a huge difference. And it's also really difficult to do a study that shows that Meatless Monday is actually reducing meat purchases when implemented institutionally. But we do see that the people who try something like Meatless Monday are more willing to try a plant-based meal when eating out at home or at home. Imperfection should never be downplayed as a success. This is also relevant when we work with other dietitians and even across disciplines. What are conversation starters? What can move the dial a little closer? The second is be adaptable and culturally relevant. Ask questions. It's okay if you don't know. There's a wealth of inherent knowledge with the people we work and interacts with. Working with Afghan women for several years in gardening, nutrition, and food preparation, I quickly questioned, who was I to teach them to cook? They were the experts, and they even told me so as I was teaching them how to enhance the nutrition in their meals. What did I do? Well, I let them cook, and they showed me. Did they get everything I told them? Maybe not, but we exchanged ideas and knowledge. I hope they felt valued and heard, and as a result, they were willing to make the changes they needed to enhance the nutritional value of the food they produced and prepared. Also in East Africa, I was part of a health team working with diabetes patients who were poor, did not understand their disease, and did not have adequate resources for testing or treatment. Despite there being only one clinically trained nutritional professional in the country at that time, we set out training nurses and doctors to talk about diabetes simply and to give practical contextualized nutrition advice that would improve their long-term health. The third is don't fear policy. Consumers aren't going to turn the dial alone, yet their role is important as they create demand and interest. But the pressure should not be on them. Policies drive so much of the food system. Nutrition professionals should be aware of and advocate for better and more nutritious focused policies. We may be the only ones looking out for this in many of our conversations that we have, such as producing calories versus protecting nutrients in the agriculture. And finally, who are your gatekeepers? Learning, being a learner and listener is often overlooked. And because of that, we can miss so much, including our sources. Often, actually more often than not, the people who can teach us the most are not the leaders. They are the workers, the janitors, the farmers. Sure, we might put them on stage at a big international event, but they can contribute much, much more. So personally, let these other perspectives drive your work and your approach. It may not make you famous, but it will help you do work that really counts. So you can, next slide. So in conclusion, I'm really pleased that these conversations are happening and that there are many dietitians and others engaging. I strongly believe that the contribution that nutritional professionals have at all levels, research, communication, consumer education, professional education, policymakers, international leaders, farmers and food producers, manufacturers, chefs, community liaisons, and so much more. I'm going to now pass it over to Dr. David Katz. Thank you.
Thank you very much, Becky. Folks, warm welcome to our Diet ID Food Truths frequent flyers. Special welcome to you. Hope you found the boarding process comfortable, plenty of room in the overhead bin. Special thanks to Dina Aronson, who has ever got us all organized and did such a lovely job introducing us. And in particular today, bountiful love and esteem to Kate, Chris, and their team at Food and Planet. As I've likely mentioned in prior webinars, I've been ranting for some years now from podiums when we used to be at podiums, that you really can't call yourself a health professional anymore if you don't advocate frequently and fiercely for the health of the planet. There are no healthy people on a ruined, uninhabitable planet. Addressing the confluence of what's good for people and planet is the signature issue of our time. So I absolutely love and admire what Food and Planet is all about. We Homo sapiens are fortunate. We might have been obligate carnivores. We might have been obligated to consume for our own well-being a diet at odds with the needs of the planet and sustainability now that we have accrued to nearly 8 billion of us. And so we might have experienced this tension where we had a choice to make between dietary patterns that were addressing the needs of human health, dietary patterns addressing the needs of planetary health. Next slide, please, Chris. Fortunately, that's not the case. A number of seminal reports on diet quality measured objectively with regard to human outcomes, morbidity, mortality, and dietary patterns and their specific contributions to issues of sustainability have been published. They've been cited previously. And a number of research projects out of Oxford have looked in granular detail at the overlap of these two imperatives. And we are very fortunate to have the opportunity to choose a grand confluence. Click the animation, please, Chris. Namely, reports like Eat Lancet identify dietary patterns that are associated with all the things we want to do for humans: add years to lives, add life to years, prevent chronic disease, maximize vitality, and do this within sustainable boundaries. We begin this conversation by acknowledging that we absolutely do have the choice of optimizing human health and optimizing planetary health, preserving biodiversity, obtaining our food in a sustainable manner. By the way, this won't figure much in today's conversation, the pandemic, but all of these things absolutely do relate to the origins of pandemics, which have a great deal to do with the sourcing of food and equitable access to food among populations around the world. By getting this right, this grand confluence represents the opportunity to do what my career was originally all about: adding years to human lives, adding life to human years, but also preserving the gems of this planet like the Amazon basin, preserving our aquifers, arresting the cruelty and abuse of domestic animals farmed at factory scale, and preserving the wild places so that trees are not cut down for palm oil plantations, but are preserved for orangutans to climb in places like Borneo. All of this is possible. All of this is the grand challenge that we confront together today. All of this is what Food and Planet is expressly about. Next slide, please, Chris. So we can think about dietary patterns that are best for human health, dietary patterns that are best for the environment, but the sweet spot obviously is the overlap. And that's what these initiatives are about. And it is kinder and gentler. And others in the mix here today are more expert than I on issues of social equity. Obviously, kinder and gentler means kinder and gentler to our fellow creatures who aren't being mass produced for our consumption and abused along the way, but it also means kinder and gentler to one another, that we democratize the production of food, we democratize access to food so that high quality diets are not a have and have not situation, but we make global use of our resources in a manner that's globally equitable. That's all part of this as well. That truly is the sweet spot. So the particular element we are contributing from Diet ID begins with our innovation in assessing and tracking diet. We have a patent pending methodology for developing dietary fingerprints, essentially identifying in very consolidated images of select foods a specific dietary pattern at a specific objectively measured quality tier using the Healthy Eating Index 2015. Well, we populated an entire map with these images. And like any map, it's got coordinates. So we could talk about latitude, longitude, X and Y axis, but we can also just talk about diet type by diet quality. So essentially the X axis is diet type. And we arrange these from animal food predominant over on the left, or what we could call the West of a map, to plant food predominant and exclusive on the right, or the East, if you will. We also went from low quality on the HEI 2015 scale at the bottom to high quality at the top. And it was very early on in our work that people like Walter Willett and David Jenkins, who were advisors to us, said, you know, there's a very significant gradient here, if you look at the diagonal, with regard to environmental footprint. Basically, we're going to higher quality diets with less highly processed foods. And we're going away from animal food predominant foods all the way in that northeast corner to plant food exclusive dietary patterns. Well, can't we do something with that? Can't we perhaps develop a metric that quantifies shifts in the environmental footprint of diets and build that into the app and make that universally available? Next slide, please, Chris. And so we began looking into this actually as long as a couple of years ago in a project that's only now ripening. And we've tapped into a burgeoning literature on this very issue. What are the component measures of the overall environmental footprint of our dietary patterns? And how do these relate to measures of objective diet quality related to human health outcomes? And once again, the news is good because the confluence is very high. This again is work out of a group at Oxford, among other places. Marco Springman, the second author listed here, is one of the lead authors of the Eat Lancet report. Next slide, please, Chris. So in this work, they basically looked across a spectrum of considerations related to both human health and planetary health. It's a little bit busy, but let's just focus across the top of these two clusters of bars here. So with regard to human health, there's all-cause mortality and then specific morbidities, coronary disease, cancers, in particular colorectal cancer, diabetes, stroke. And as you might guess, the foods are distributed here with regard to their contribution. Green is good, red is bad. So let's just focus on the green for the sake of expediency because there are other speakers lined up ready to go. So whole grains, fruits, vegetables, nuts, legumes, the usual suspects, in other words, all green. Green with regard to all-cause mortality, coronary disease, colorectal cancer, diabetes, stroke, all good. Now let's look at the bottom cluster bars in B, same issues, except now these are component measures of environmental impact. And this is really important. It's not just one thing. You know, in some places where water is scarce, water utilization may be a greater concern than greenhouse gas emission. For us globally, impact on the climate is probably the biggest issue. But there's also how much land is being used, eutrophication, acidification. So all of these are component measures of a comprehensive, yeah, Chris, let's just stick here for a minute. So at B, once again, the foods that are all in green having the least environmental impact across all measures, whole grains, fruits, vegetables, nuts, legumes, pretty much the same cluster. We can jump now to the next slide, please, Chris. And this is that same information plotted in a way that's maybe easier to take in at a glance. So relative risk of human mortality, x-axis, and overall environmental impact on the y-axis, aggregated across these component measures of environmental impact. So water use, land use, air use, greenhouse gas emissions, and so forth. And by the way, ultimately impacts on biodiversity and so forth. I mean, all of this is potentially captured. Social equity could conceivably be as well. But you know, the good actors here in green, you know, the diets that make up those 7 pithy words from Michael Pollan, right? Real food, mostly plants. So yeah, we and the planet would be better off if we could get everybody to mostly eat vegetables, fruits, whole grains, beans, lentils, nuts, and seeds, and drink plain water when thirsty. That's the fundamental takeaway from today's discussion. Good for people, good for the planet. We can do this if we rally around it. Next slide, please, Chris. So we have a project called Diem. Obviously, it emanates from Carpe Diem because we're running out of time, folks, so we have to seize the day. But Diem in this instance stands for Dietary Impacts on Environmental Measures. So we're commissioning some of the world's leading experts on the detailed, granular mathematical assessment of environmental components of dietary intake patterns to help us put together a quantitative measure that aggregates across these components, weights them appropriately, that can be applied at the level of overall dietary pattern, which we can then capture within the context of Diet ID's intellectual property and appify. So essentially, we can allow people within the span of 2 minutes to find out what is my diet currently, what goal diet am I willing to adopt, and how would that quantitatively on an objective validated scale alter the overall environmental footprint of my dietary intake. And what we hope to do is figure in, I think it was number 7, Chris, on the list of 8 actionable areas, raise consumer awareness and make our particular contribution to the grand agenda of Food and Planet and so many other organizations to optimize the health of people and planet alike. So look for the Diem project to be announced very soon, progress soon thereafter, and we hope to have this function available in our app sometime in 2022. Next slide, please, Chris. And you've just hit the animation. So I routinely note that it's not what we don't know about diet that most threatens our health. It's the wild misrepresentations of what we do know. In today's context, I would argue that's true about people and planet alike. We have the knowledge. It's efforts like this that translate what we know into what we put to good use, into what we do. That's really where the power resides. And again, it's a privilege to take part in today's discussion. And with that, I pass the baton to Dr. Selena Ahmed.
Thank you so much. It's wonderful to be here today, and I just wanted to express my enthusiasm for the white paper. So many times dietitians and nutritional professionals that I'm working with ask what are tangible strategies to advance sustainable food systems, to advance sustainable diets, and it's so amazing to have this very tangible white paper with these 8 very tangible strategies regarding advancing sustainable food systems and sustainable diets as nutritional professionals. So this is something that I imagine myself referring to in my teaching and my practice and my collaborations. And I think it's going to be really, really valuable for all of you. So really wanted to commend the Food and Planet team for putting this together. It's such an amazing resource. Next slide. And so one of the reasons that I think it is so critical to take a sustainable food systems approach as nutrition professionals, as dietitians, is to avoid what I call the whack-a-mole effect. So you can raise your hands. How many of you are familiar with the whack-a-mole game? And so those of you who have played it, you can sort of think about each mole being a problem. And if you're just addressing diets, just addressing nutrition, you're then missing the environmental attributes and aspects that are linked to sustainable diets. You're perhaps missing the cultural inclusion criteria that are linked to sustainable diets, the economic injustices that are linked to sustainable diets. So really, really critical to not just focus on thinking about healthy diets, but really embracing these 4 different dimensions of sustainability. And so it's really, really critical to be working together. And this is one reason that I'm so excited about this white paper. Next slide. And so the Food and Planet team presented some reflection questions for the panelists, and I'm going to take the next few moments responding to the 2 questions that I was given to reflect on. So the first question is, how can we work across disciplines to honor the 4 dimensions of sustainable food systems, the sociocultural, the economic, the planetary or environmental, the nutrition or overall human health? And so it really starts, and this is going over what Chris was saying, with education. We need to train future leaders of the food system to have the capacity to transform the food system. And equally important in having the capacity is having the motivation for doing so. So I think motivation is really, really critical. And in addition to classroom training, which gives us our diverse ways of knowing, equally important is experiential learning, which gives us our diverse ways of being. And so that's really, really critical. Experiential learning comes in lots of different forms. This could include service learning projects in the diverse spaces where nutritional professionals learn and practice. And this really then begins to give us the capacity of how to think in different ways, how to engage in different ways. How can we really begin to look at diverse perspective, inclusive perspectives in the way people are approaching food. So those are really, really, really critical. And so this is education at the university level, but also professional development, such as this specific session. Next slide. And then once we have that training in working and collaborating with diverse practitioners and other community members, then really taking that knowledge to engage in community-based projects where we're working to advance sustainability, to advance sustainable food systems. So whether we're working in a hospital, whether we're working at a school, whether we're working in a food bank, whether we're working with indigenous communities or rural communities, really to become champions and leaders of starting projects in advancing sustainable food systems, in advancing sustainable diets. And so this really starts with integrating and working with diverse collaborators to establish the community needs, as well as to begin to really take a practical approach that integrates all the different dimensions of sustainability. And equally important in this is having an advisory board that has members of diverse stakeholders to bring in inclusive perspectives and voices to the table. And so in addition to experts in the different disciplines of sustainable food systems, including economists and nutritionists, environmentalists, ecologists, also working with people in the community that are actually working in practice in those areas. And so, for example, I've been working for the past 5 or 6 years on the Flathead Reservation in Montana with an indigenous community and a project to advance sustainable diets. And as part of this project, we're working with students, we're working with the tribal community, we're working with a nutrition scientist, we're working with an ecologist, we're working with local food banks, and we're working with supermarkets, and all collectively working with the common goal for advancing sustainable diets and sustainable food systems. And this project, a key aspect of this project is having a community advisory board to guide the project in making sure that we're not just looking at the project from our perspective as scientists, but really taking into consideration the community needs and ways of being. Next slide. And so next I'm going to address the second question that I was presented with, which is how can nutritional professionals help shift food systems towards becoming more sustainable and inclusive of culture and underutilized species? And so this is where I encourage the students I have in the classroom, as well as all of you, to really take an ethnographic approach to become ethnographers as nutritional professionals, to begin to understand the diversity of cultures that you're working with, the diversity of cultural groups, and really beginning to look at food and nutrition from their perspective. And so really trying to understand the decisions being made regarding what supports health and nutrition, also beginning to understand and recognize the diversity of foods that people eat. This includes underutilized species, which I'll talk more about, as well as the diversity of places where people procure food, including from wild food environments. And again, in taking an ethnographic approach, it's also really important, as I mentioned before, to be guided by an advisory board, a community advisory board, where you're bringing in perspective from different cultures, so you can then really begin to integrate culturally responsive practices in your work. Next slide. And so as part of looking at underutilized species, it's really important to then begin to look at the food environment where people are procuring food. And often as nutritional professionals, we focus on the built food environment. This includes both formal as well as informal markets, including supermarkets, convenience stores, restaurants, farmers markets. Also important to recognize, especially when we're working with rural and tribal populations, including here in the United States, is looking at the natural food environment, which includes both wild and cultivated spaces. And this is where people are directly procuring foods for subsistence, for dietary quality, and for food security. And so in terms of being inclusive, it's really, really important to recognize the importance of those spaces. And many times as nutritional professionals, we're not thinking about ourselves as conservationists. And this is where I really support as nutritional professionals in understanding how important wild foods could be for food security, for dietary quality, because of their unique and diverse biochemical profiles for supporting nutrition and human health. It's really important for nutritional professionals to also then begin to take a role in conservation efforts in conserving ecosystems. Next slide. And so I wanted to conclude with this slide, which shows diversity of berries that are consumed, or the most commonly consumed berries that are consumed here in Montana by rural and indigenous populations. And I wanted to bring forward the concept of conservation for nutrition. And so in the past decade, the concept of agriculture for nutrition has been promoted. And I wanted to support the concept of conservation for nutrition, which I define as the preservation and management of biocultural diversity associated wild food environments, including biodiversity, ecosystem services, ecological knowledge, values, and practices as a nutrition-sensitive intervention. And so just wanted to conclude with that of the importance of nutritional professionals thinking about their roles in conservation. And I think that is it. Thank you. I will pass it to the next speaker, Liesl Carlson.
Great, thanks so much, Liam.
Thank you, and thank you, Dr. Ahmed. So much of what you have shared, as well as the speakers before me, really resonate with both my experience in research as well as in practice. So thank you so much for those. Thank you also to the Food and Planet folks for inviting me to this launch. I feel very honored to participate in this. So next slide, please, Chris. Okay, wonderful. So before I get going, though, I do want to acknowledge the work that has come before us. And this, I think, is really, really important, is so many of the things we're talking about, although for me, still really exciting, they're really not new. And I think it's really important to acknowledge the many projects and initiatives and mobilization that has happened before us for nutrition and the nutrition professionals who have been trying to incorporate socio-ecological ways of thinking about nutrition for a very long time. So just as a couple of examples, we currently have the critical dietetics movement, which is existing today, looking at what I would call more social sustainability related components of nutrition practice. We also have examples in things like the eco-dietetics movement, in the New Nutrition Science Project, in ecological public health, ecological nutrition, and from the United States, there's a great example from the late 1980s, where Gusso and Clancy published their dietary guidelines for sustainability. And this was long before food-based dietary guidelines were coming from nations and including sustainability components. We can go back as late as the late 1800s, where Ellen Swallow Richards, who's credited with being both the mother of human ecology and home economics, and some of the field of nutrition and dietetics have come out of there. She was looking at water toxicity and how that was influencing people's health. And then I think I would be remiss not to mention that throughout human history, groups of people all over the world have been adapting and living sustainable diets, right? So that's not to discredit what we're doing here, but I think it's really good for us to remember that we are building on what has been going before us for a long time. And then also just to highlight the fact that it's really also just good science. Many of the problems we're talking about do not have their roots in biomedical science, and a good researcher will use the tools from the appropriate fields to answer the question that we're asking, right? And so we really just have good science when we're talking about combining nutrition and sustainability research. Okay, so on that note, what I'm going to share with you is a little bit of the work that I've been doing with the International Confederation of Dietetics Associations, or the ICDA. And the ICDA, as early as 2016, we're starting to ask the question, what is the role of nutritionists and dietitians around the world in these conversations? How do we prepare our members to be sitting at the table, and in some cases, not just sitting at the table where these conversations are happening, but leading the conversations, right? Nutrition and food is what we do. And so therefore we should be ready to lead these conversations. And so the image you see here is a picture of the report that we concluded in 2019 and have shared it with the ICDA. It's publicly available on the website, so I can direct people to that if they want to see it later on. But what happened was that together with a number of colleagues, but in particular, Dr. Edith Callahan, we, on behalf of the ICDA, initiated a conversation with 70 different nutrition professionals from around the world, from 30 different countries. And you see on the map here, the sort of overall contributions, both in breadth and in depth. As the little markers get bigger, you had more and more people participating from certain areas. And we talked about, well, what does sustainable food systems mean to you, and what's our goal or what's our vision as a profession? What are some of the barriers that stand between your practice today and achieving that vision of a sustainable food system or sustainable food systems? And then what can we do about it? And from this report, there are a couple of pieces of information that I think are really relevant to the launch that we are part of today. And they have to do with barriers. Now, there were quite a number of barriers, but two of them are really relevant to the profession. And the first one that I want to highlight is that dietitians and nutrition professionals around the world were saying, there is so much information coming at me, and there is so much misinformation. I'm actually not quite sure how to sort out what is relevant to me, and then also what to do with it. And a second barrier that's really worth highlighting is the fact that many dietitians and nutrition professionals felt that they did not have the social license to practice in this area. So I want to take a moment to acknowledge that there were many participants who were absolutely contributing already to sustainable food systems and diets. I'm going to give out a shout out here to Stacia Norden, who I know is in the room and doing fantastic work in Malawi. There were a number of dietitians in Sweden who were sharing fantastic work they were already doing around food waste in institutional settings. I'm sure many of the people on this call are already doing a lot. But in addition to that, we heard a very strong message that we're not prepared and that it's not within our scope of practice to be talking about environmental issues and social justice and biodiversity and all of these things that we consider as inherently part of the sustainability story. So I could summarize by saying there seemed to be a barrier with competence and also a barrier with confidence in entering into this space. So then, how do we move that needle? And at ICDA, one of the decisions that we made was, in order to be able to support more and maybe more thorough participation from this profession, is that we need to address some of those barriers. And we chose to do so in a number of ways. And so together with a number of colleagues, former students, currently, some of them currently on this call, we developed a toolkit. And there's a few things that I want to highlight about this toolkit. And the first is that the toolkit was really in response to those first, the competence and the confidence barriers that we talked about. And you can see the leaderboard across the top of my screen there. It shows you a little bit about, what are you going to find in this sustainability toolkit that we've developed to support dietitians and nutrition professionals to do this type of work. And with respect to competence, there's a number of different components that are under the resource section that help people to find information, to learn more about what these topics are. You'll also find a section on a community of practice where communities of nutrition professionals can communicate with one another. And that's a fairly new piece there, but it's meant to set up more collaborative knowledge development. And then there's a professional development section, and that includes things like great podcasts that we know of, webinars that have come and gone, have been recorded, courses that are available if people want to participate in these things. So what are we finding? We're finding that within the year of launching this, we have over 2,000 nutrition professionals around the world who are tuning in and using this website for various things. We know that those users are coming from 65 different countries from around the world. So it is absolutely spreading. You can see on the right-hand side of the slide there, those are our top 5 countries who are using them. And this is where I confess that the builders were a team of Canadians, right? So you can see Canada at the top, and probably because that's who we've been spending our time talking most to, that's where our networks are, but please help us share. So this, I think, is a really important piece, is that, we are starting the conversation about supporting nutrition and dietetics practitioners. The next thing that I want to share with you is that, in terms of how do we leverage change or how do we support this profession through addressing barriers, one of the things that's important to note is it's worth looking at a more granular level on what do we mean by these competence and confidence barriers. One of the tools that we've set up on the toolkit is called a sustainability self-assessment. And I'll give a shout out to Haley Jenkins, a former student, current colleague who helped to design this part of the toolkit. And so it allows, amongst other things, it allows the user to talk about what their level of confidence and competence is. And so we have it divided into 3 categories. The first one is, I am new to this subject and this concept, and I want to learn more about the topics. The second category is, I have a good working knowledge of sustainability concepts and topics, but I'm unclear how it's relevant to myself as a nutrition professional. And then the third category is, I have a good understanding of the concepts and topics and the relevance to my practice, but I need help doing this. I'm unsure of how to proceed. And you can see the relative frequency over on the right-hand side there. And these statistics are now old. We have data coming in daily on this website, but you can see the approximate split. And maybe the one thing I'd like to highlight here is that, approximately 70% of people going to the toolkit fall into the first 2 categories. They're feeling like they don't have enough knowledge to proceed, right? And so I think that's really worth noting. And I think one of the things that's so important about conversations like the one we're having today, like role papers and position papers that we're starting to see pop up from associations around the world, so nutrition and dietetics associations around the world, are really specific statements around role, around the role, around specifically what we should be doing, that really help dietitians and nutrition professionals to see what it is they should be doing. And then, as you've included in the white paper, a number of really specific activities that you can at least begin with. So those are really helpful for that component. Okay, so, and I'm going to end off on this, competency development that needs to come alongside confidence development. One additional component that we've included on this toolkit is a self-led learning suite of learning modules. And we've aligned them with those 3 levels of confidence and competence. One is, what are sustainable food systems and diets? The second one is, how is this relevant to me? And the third one is, how do I do this? And so in designing these, we're hoping to really help to move the needle. The piece that I want to highlight is, we know dietitians are using them. The way that they're currently set up is that we can't necessarily see whether they're completing them yet, but it's one of my goals this year to be able to move those to a more formalized structure so we can actually interact with their users. And then the final piece I'll add to this competency development, which I think is a really important part of this story as to how do we proceed, is that I'm working together with an international group from Canada, from the US, from the UK, and from Australia to examine how nutrition professionals are trained. Although we don't have any formal results ready yet, I think what I can very safely say is that very few countries are standardizing sustainable food systems and diets as part of their core competencies for trainees. And in addition to that, you have really ad hoc and a wholly unsystematic approach to how these topics gets taught or not taught in some cases throughout our training. And so that's a really, really important piece. I mean, if we want to step into these roles, we need to actually train for that. Okay, so I'm going to end there. I'm really looking forward to a conversation about how to proceed and how to really amplify the work that Food and Planet has been doing. Thanks.
Thank you, Liesl. That is wonderful. And I'm so grateful we ended with you to kind of pull the lens back to this global perspective for our profession. It's wonderful to see what's happening in the chat. And before we go to the Q&A, and just a couple of housekeeping things, please stay if you can till the very end. We're going to do about 12 minutes of a fireside chat with our panelists, and then there will be a 2-question survey. And you will get, just as a reminder, a follow-up email with all of the links to the paper, recording the slides and the CPE instructions. So stay tuned for that. And now I know we're all basically in boxes somewhere around the world, most of us sitting in offices, but let's imagine for a minute that you're all at my house here in Idaho and it's a crisp fall day and we're gonna pull up around our outdoor fire and have a nice chat with our esteemed panelists. There have been some great questions coming in. Feel free to add more and we'll certainly try to answer as many as we can. So this first question, I'm going to address to Becky because they specifically asked to have an RD and it has sort of an American focus. So Becky, I'd love to start with you. How do we navigate, in your opinion, certain concepts that might not be popular for certain industries who lobby hard for a place at the table to maintain status quo, such as red meat and animal products? Should the Academy of Nutrition and Dietetics be a leader in promoting sustainable food systems? And then related to that, what does that mean around things like sponsorship? Or I know there's been a lot of conversation in the chat around fancy sessions. So just kind of your thoughts as you've been navigating that. What have you seen worked and what are your thoughts around that? Thanks.
Wow, that's a tough one. That's a good question, though. Navigating, it's, I think conversation is always a good way to go, as we know. But certainly, we are not, make it clear that we are not, even with like Meatless Monday, it's, like I was talking, that's like the smallest step you could possibly take, but they get some really strong reactions from, the meat industry, which is funny because, they're not advocating for a vegan or even a, meat-free diet at all. So, but there has to be this, I think people need not to feel threatened. So conversation is important. And I think that even, working into different organizations and across different professions, again, trying to find some common ground and have that conversation. Like we're all, I mean, everyone wants to promote sustainability. So how can we do that? I don't know if that, it won't always work. I think some people are on their, some are on their defense, but just to understand where they're coming from. There's a lot of problems with industry and businesses, but we need businesses and we need the market. And so we need to make sure that, we can work with them. Remind me of the next, there were 3 questions there.
Oh, it was, should the Academy of Nutrition and Dietetics be a leader in promoting sustainable food systems?
Absolutely. I mean, I feel like that is so important, as, we've seen, and I think everyone here knows that, as we're talking about nutrition is cross-cutting and nutrition is impacted and is impacted by, by our planet and how we produce food. And if we can't produce healthy food on an ongoing basis, we can't have a nutritious diet. We've heard that in different forms. So we can't ignore where our food is coming from. And if we do, we're back to that very narrow focus, and we're really undermining our credibility and we're undermining the strength of our work. So I would love to see the Academy take a stronger role on this. Someone talked about it being part of competencies for dietitians. I think it's starting to be incorporated a lot more than when I trained. And that's exciting to see. But, and then back to the sponsorships, I think that I think when you get funds, you're going to be biased. It's going to impact, who what speakers you have, what message you have. So I do, I don't work for the Academy, I can't say, but I do feel like, there needs to be a really good look at who's sponsoring and, what message you are putting out, even if you don't feel like you're being impacted by that. I mean, at our center, we're really careful about that. We don't even the growers organization for peanuts, we had to be careful with, like what's bad about peanuts and sustainable food and the earth. But we don't even accept funds from things from that. So we're fortunate not to have to do that because of our funding source. Not everybody is fortunate. So we do just need to examine what message we're putting out as professionals and professional organizations.
Thank you. I really appreciate the candidness. I think that's almost what's missing sometimes in our profession, is allowing the space to have the honest heartfelt dialogue, and to make sure no one feels personally threatened or attacked. I really liked how you framed that. I think that's really true. And I would just offer the Eat Lancet or the Eat report on the G20, like for developed economies. One real insight that I know we talked about a lot at Food and Planet was even just bringing consumption into alignment with dietary guidelines can have a real impact in developed economies. So in terms of finding a starting point for people to align on, promoting consumption within what's even recommended would be a significant reduction. So maybe creating a wider tent pole for some people as a start before they explore something like a Meatless Monday or these other great things. Okay, my next question is for Dr. David Katz. And the question that came in was, do you have specific examples of organizations adopting sustainable food measures and demonstrating ROI? By ROI, I'm thinking not only bottom lines or profit margins, but perhaps wellness or health metrics. Dr. Katz.
Well, not nearly enough, because there really isn't enough going on yet with regard either to optimizing nutrition for human health, certainly not for sustainability, which is why an effort like this is so important. I'll talk about ROI in just a second, but I think we do need to be very adamant about the timing of this conversation, right? I mean, we could be talking about beef, we could be talking about coal. The coal industry doesn't want us to stop burning coal. We have to stop burning coal. Sorry, you're not a bad person if you were in the coal industry, but it's obsolete. We can't do it anymore. 8 billion hungry Homo sapiens cannot be eating beef routinely, period. So the distribution of animal food, so it nurtures and sustains populations that need actually to add some heterogeneity and balance their diet, is where those products should go. But it's a time where these issues really are critical. So there, yes, we need to accommodate everybody, link arms, sing kumbaya whenever we can. But I think there's an opportunity here for some righteous outrage. The planet is intensive care, right? I mean, this is not theoretical anymore. We're all experiencing in our faces the effects of climate change. We're all experiencing a pace of extinction that's only rarely been seen in all of history, usually due to huge collisions with asteroids and the like. So we are the asteroid, and we have to reconcile with that. Quickly about ROI. So there's not nearly enough about sustainability because it hasn't been done enough. Let's fix that. We developed an ROI calculator specifically for human health effects of improving objectively measured diet quality. Because you've got a hammer, you go looking for nails. We have the means of assessing dietary intake comprehensively in 60 seconds. That's what we do at Diet ID, among other things. So we've deployed that into wellness programs and CHIP and diabetes prevention programs and so forth. So, in a matter of days and weeks, we can measure the average improvement in diet quality. And there is a literature that says when objective diet quality improves this much, biomarkers change this much, the incidence of chronic diseases, cardiometabolic disease in particular, obesity, hypertension, dyslipidemia, coronary disease, type 2 diabetes, changes this much. And then there's a literature that says if someone goes from non-hypertensive to hypertensive, non-diabetic to diabetic, non-symptomatic coronary disease to symptomatic coronary disease, here's what happens to their average annual costs. $2,000 when you become hypertensive, $9,600 if you develop type 2 diabetes, $19,000 annually if you develop coronary disease. So if you obviate that, you obviate the costs. So if you can improve diet quality as an upstream measure and prevent the incident conversion to any of those states of chronic disease, you are saving, per person per year, $2,000, $9,600, $19,000. We did that math. You can actually access this tool via the Diet ID website. You can plug in numbers. So I'm managing the health of a population of 1,000. We do not yet have the fully developed DM tool to fold sustainability considerations into the mix, but improvements in diet quality track closely, thank goodness, with improvements in sustainability and impact on the planet. So it's a rough proxy until we have DM done. And you can see that there is potential for significant cost savings. And so there's an opportunity then for large employers, insurance companies to get in this game and say, we want to fund this. By helping people achieve diets that are better for them, better for the planet, we're saving everything we need for the next generation, the next, and the next. And yeah, we ought to do that. But we're also saving money in the near term while doing the right thing. There's a huge opportunity there.
As my 14-year-old son says, money talks. Sounds like what I'm hearing.
Always, always.
That's great. Thank you, Dr. Katz. And then our next follow-up question, we'll see how many more we can squeeze in, but one or two more is for Selena. And this was around packaging. How might we advocate for sustainable food containers? For example, I love my blueberries, but feel bad about the plastic containers I send to recycling each week. Also, I love the small local gardens that are becoming more common, but how do we make sure that local growers are following safe and sustainable farming practices? How might we track incidents of foodborne illness through those smaller resources? Sustainability as well as food safety are important. Selena.
Excellent, great question. And that question had multiple parts. So I will start with packaging. I think when we're thinking about food systems, often we're focused on what's healthy to eat and the sustainability of the food itself. So blueberries, where they're coming from. But I think thinking about the packaging is so critical. Thinking about the food waste, and we know that's more and more contributing to so many issues that are contributing to exasperating planetary boundaries and safe limits for society. And so really, really important to begin to thinking about packaging, just because the food you're eating is healthy, has this beautiful phytochemical profile for mitigating diet-related chronic disease. It's coming in this packaging. And so ways of procuring blueberries that don't have that packaging, I think really involves, letting your supermarket or wherever you're procuring the foods from know about your food preferences. And so there have been cases where consumers have changed packaging from being in plastic or to more compostable packaging, cardboard packaging. So just really championing and having that dialogue with where you're procuring your foods, that as a consumer you have a lot of power, and just really recognizing that you have that power on a very practical level. Just having that conversation. Where I get my food from the food co-op, we can make recommendations, and so many times the recommendations are met during their board meetings. So really just championing that. And then the second part of the question was for food safety for local food systems. And so in different states, there's regulation with food systems and food safety monitoring. And so while there is concern about food safety for local food systems, I believe in most states they're overseen by food safety monitoring. And so I think just really understanding the regulations in your state is really important. I know here in Montana, there's a food sanitarian that oversees the regulations of the local farms and the selling of food. And so I would recommend people, if you're interested in understanding this food safety in your local state, to reach out to your local food sanitarian that's overseeing local food systems. Thank you.
Thank you. Wonderful. And oh gosh, Liesl, I'm sorry, we ran out of time to ask you your question. So I may pop it on social media, but I want to be respectful of all of our participants, and maybe just transition over to Chris for a final wrap up for the webinar. Thanks, Chris.
Yeah, great. And while I'm wrapping up, I think we will have Dina launch the survey. So please stick around. There's only 2 really short questions, but we'd really love to get your insight. And thank you all so much. That concludes our fireside chat and Q&A, our panelists, and introduction to the white paper. We wanted to give a huge warm thank you to Diet ID for helping host and present, as well as all the esteemed panelists from across the food system. We're so honored to have you here. And all of you that are attending today. We have hundreds of you joining from around the world. I'm hoping that more will join us in the recorded session as well. Thank you so much for your enthusiasm, your passion for making the food system healthier and more sustainable. The CPEs will be coming within the next week via email, as well as a link to the white paper and any links and resources that were mentioned today, including the slide deck. So please feel free to continue the conversation on our social media at foodplanet.org, or you can go to our website at foodandplanet.org. Thank you all so much, and we will continue the conversation offline. Have a good one.